p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on WeFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
And a very pleasant good evening to you. This is, the month of April, and time is really flying this year. Already we're into the fourth month. And ladies and gentlemen, I want to welcome you to Your Health Matters. Your Health Matters. And remember, this is interactive. Remember, you can ask me any question you want. I know a lot of persons who just sitting back and relaxing, and that's fine. We always have a particular message that we want to bring off, but you can interrupt us. And any burning question that you may have, remember 457-9997, both as a straight number or WhatsApp, we'll certainly be willing to entertain your call. And if we don't know, we'll tell you that we don't know, but if we do have some insights, we would love to share those with you on the subject that you had asked. Recently, I know I've been talking a lot about the subject of mental illness. It's for good reason. But more so this morning, I was listening to my morning news, and one of the important sportscasters that I listen to, a person by the name of Stephen A. Smith. Stephen A. Smith. There's a person named Stephen Smith, and there's a person called Stephen A. Smith. He's a black commentator, on basketball, football, athletics. He's big. He's one of the biggest names, one of the highest paid black sports commentators around today in the United States. I admit I listen to him. I like his style. And he came out this morning and said that he has been suffering from depression. And he said it's rather strange. His mother passed away in 2017, and he found that after he essentially couldn't handle it. He was very close to his mother, in spite of the fact that he's quite an aggressive sports commentator. He must have been very close to his mother. But the thing is that for the last couple of years, at first he ignored it, and for the last year or two, he's been on the trim. He said he's much better, but he wanted to come public on this. He wanted to talk about it to help. And around the world, you see persons like King Charles, who's come with a diagnosis of prostate cancer. In England, scores, hundreds, thousands of men have gone to get their prostate tests. And Stephen Smith coming out and talking about depression is something that will help. And so I want to talk about depression today. And I've spoken about it before, but bear with me. I want to talk about it again today. I want you all to listen because, depression is a fairly common mental illness. And globally, there's approximately 4.5 to 5% of adults who suffer from depression. You know what that is? That's over almost 500 million people who suffer from depression. And you've heard me talk before, more women suffer from depression and affected by depression than men? Well, I'm going to come back to that in a minute. Depression can sometimes lead to a word I don't even want to talk about, but let me say it's suicide. And there is, though, very effective treatment for depression, whether it is mild, moderate, or severe. Depression can be treated, can be handled, various skills can be taught. The problem often is people not coming forward and seeking the treatment that is available. So, depression, as we know it, as I said, is a common mental illness and involves a depressed mood or the loss of pleasure or interest in activities that persons may have seemed to be enjoying and that they've lost the pleasure or interest in these activities that people have been doing for a long period of time. And that is what we call depression. Now, depression is different from a mood change. Come on, you understand what I'm saying? All of us have a mood change. You know what I mean? We have a mood change. And that's all right. That happens. The weather's too hot, or you want to go out and it's raining and you can't go out. That's going to cause a mood change. If somebody passes and says something to you, that's going to take a smile off of your face. That's going to give you a mood change. But depression can affect all aspects of life, including relationships with your family members, your spouse, your kids, other members of your family, friends, your work mates, and of course with your community. It can result from or lead to problems at school, at college, at work, or in various other groups you might be in, sports groups also. And depression can happen to anyone. That's the important thing. Now, depression won't happen to everyone, but depression can happen to anyone. And I want persons to really understand that concept, that one could be surprised that depression could affect you. As a matter of fact, depression, though typically can affect people who have lived through various forms of abuse. People who've lived through various forms of abuse. Or if there's been severe losses, such as a family, loss of a job, loss of a limb, your leg get cut off, it's going to cause some depression, can cause them depression, right? Or other stressful events are more likely to cause depression. I said it before, I'm going to say it again. Women are more likely to have depression than men. But today, I want to talk about the men and their depression. And if we've said that approximately 3.8 to 5% of a population experience depression, we are saying that this includes 5% of adults, 4% among men, 6% among women. That's why we get 5%. And that depression is higher for people over the age of 60. And that around the world, there are over 400 million people who have depression. That's a lot of people. Depression is about 50% more common in women than men. This is about the third, fourth time I've said that. And worldwide, more than 10% of pregnant women and women who've just had a birth experience suffer from depression. Something we call puerperal depression, puerperal psychosis, puerperal, It is common among women who just had a baby. So that, and let me say this and say this very carefully, more than 700,000 people die each year due to suicide. And suicide is still the fourth leading cause of death for persons between the age of 15 to 29, 15 to 30 years old. Those 15 years, 15 to 29, suicide is the fourth leading cause of death. I certainly don't want to trigger any sort of episode of that here in St. Vincent by talking about it, but more than 75% of people in low-income countries receive no treatment at all. Barriers to effective care, including the lack of access to mental health, is not there. In some countries, it's easy to find a psychologist, a psychiatrist. You go sit down on the couch and you could talk. In other places, it's tough to find that. Maybe the cost and so, but in low-income countries, treatment often is not available. And that's a problem. So what are the symptoms? During a depressive episode, a person can experience a depressed mood. I'm not talking about a change in mood. I'm talking about a depressed mood, feeling sad, irritable, and empty. They may feel a loss of pleasure or interest in activities that they are known to enjoy. I'm not talking about it's raining, so you ain't want to go out to the cricket game anymore. I'm talking about you have interest in cricket, but you just ain't going. You've just lost interest in that. That can be an indication of some form of depression. Doesn't have to be, you could be just upset West Indies losing all the time. You say you don't want to see them lose. And I understand that too. But what about other symptoms of poor concentration, feeling of excessive guilt and low self-esteem, hopelessness about the future, not feeling good about the future, thoughts about dying, or even thoughts about taking your own life, suicide, disrupted sleep, just can't sleep, waking up, sleep. Changes in appetite and weight. Loss of weight, putting on weight. Depressive persons tend to put on weight. They don't tend to lose weight so much. And feeling tired with low energy. All of these are some symptoms. You could say, well, boy, I have some of that. I don't think I'm depressed, and you may be right. Right? Depression can cause difficulties in all aspects of life, including in your home, work, school, and the community. A depressive episode can be categorized as mild, moderate, or severe. But the important thing is, whether it's mild, moderate, or severe, it can be treated. I don't want to tell you, because it's severe, it can't be treated. You know what I mean? Only mild can be treated. No, all of it can be handled. Now, there are different patterns of depression. You could have what's called a single episode depressive disorder. The meaning is that the person only has experienced one episode or experiencing this as the first time. as a single episode. But depression could also be on a different pattern, recurrent depressive disorder, meaning the person has a history of at least 2 depressive episodes, but they could have many, many, many more depressive episodes. They just go down into a funk. They go down into a funk. Everything is all right for a couple of months, then things just go down. Then they get better. And things get better, things go down again. And then there can be a third pattern, something called a bipolar disorder. Sounds technical, meaning that depressive episodes alternate with periods of anxiety, of elation. A person is, and then they drop. They get very depressed. So come on, somebody can have episodes of anxiety. They're up, they're about, they're up at night and so forth, doing all sorts of things. And a couple of weeks later, they're down, they're crashed, the depressive moods. And then a month or 2 later, it's up again. Bipolar disorder, anxiety and depression. So you can have a single episode. You can have recurrent depression. It keeps popping up from time to time. Or it could alternate being high, when I say high, in terms of anxiety, and then being low in terms of being depression. So what are the contributing factors? Now, depression results from sometimes a complex interaction of the social, psychological, and biological factors. A lot of things that could be going on in the brain. People who have gone through adverse life events, unemployment, a bereavement, losing your spouse, losing your mother, losing your dad, losing a child, or go through traumatic event, being raped or being injured, such as also physical inactivity or harmful use of alcohol. These in terms of these episodes, bereavement and so forth, they're more likely to develop depression. And depression can in turn lead itself to more stress and dysfunction, and worsening the affects person's life situation are bringing on top of the depression. It was depression compounds the situation and makes the situation even worse because of how you are interacting with other people in the community. But depression is also closely related to and affected by physical health. Many of the factors that influence depression, such as physical inactivity or the harmful use of alcohol, are also known factors of disease of certain other diseases. So that heart disease, blocked coronaries in your heart, or depression, or diabetes, or going through cancer, or respiratory illness, or high blood pressure. These people who have these may also find themselves experiencing depression due to the difficulties associated with having to manage these illnesses as well. So these illnesses are also associated with depression. Be diabetic, having heart disease, somebody telling you your heart is enlarged, or you can't breathe properly because you have lung problems. Expect some form of depression. If somebody has those diseases and you are in their family, expect them to be depressed too. And prevention programs have been shown to reduce depression. There's no doubt about that. And so effective community approaches to preventing depression in school include, because depression could occur in kids in school. It has to be looked at in school, on the job. It's funny. There are people going through a lot of experience in life, and we don't often ask them, "How are you? Are things okay?" And really, there's a lot going on in people's lives that we don't know about. People in our workplaces. Maybe we say, "Boy, I don't want to ask. I don't want to know. I got my life to study." But, boy, I tell you, asking and helping and even talking helps. Now, in terms of making a diagnosis and treatment, I want to tell you once again, there are effective treatments for depression. And these include what we call psychological treatment, and then there's medication treatment. Psychological treatment, medication treatment. Psychological treatment are usually the first things that you should try before going on to medication. And they can be combined with medication later on, but it's good to start off with psychological treatment. What does it involve? This psychological treatment can teach people new ways of thinking. Feeling down, feeling depressed, psychological treatments can turn those feeling low, those periods of feeling low, into a different type of feeling. Psychological feelings can help you cope, the whole process of coping or relating to other people. They may include talk therapy with professionals or with people who know how to talk to persons who are having depression. And today, talk therapy is now available in person. Now talk therapy is available online, so that you could find someone to talk to online, right? And psychological treatment may be access to a lot of self-help groups. And now around lots of self-help groups, may not be many in St. Vincent, but I think there's a need for them a lot more. And I think you'll be seeing something coming out of this, because mental illness is really quite common. Now, I don't want to get into the different type of psychological treatments, but I want to tell you that ability to talk to somebody, and that person is a professional, and that person is able to guide you and help you, is really going to be an important factor of pulling you back and getting you out of the depression. But there's also some aspect of self-care, what you have to do. So self-care can play an important role in managing symptoms of depression and promoting overall well-being. Let me just go through a few of them. Try to keep doing activities you used to enjoy. So if you like going to the cricket, try keep on doing it. Don't stop. Stay connected to friends and family. In other words, it's saying don't go and isolate yourself. You ain't want to see nobody, this or the other. Stay connected. Exercise regularly, even if it's just for a short walk for 10, 15 minutes. Exercise regularly. Getting out there helps to make you feel, well, boy, I ain't really rock bottom. I ain't low. I ain't so low that I can't even walk. I can't even exercise. Walking is going to be a great means of saying, well, look, I've been able to accomplish something. Let me really get out there and exercise. It's showing that I'm still ready. And stick to regular eating and sleeping habits and patterns. Avoid or cut down on alcohol use, and don't use illicit drugs, which can make depression worse. Talk to somebody you trust. about your feelings and seek help from a healthcare provider, whether it's a doctor or an actual psychologist or psychiatrist in particular. If you have thoughts, any thoughts whatsoever of hurting yourself, remember you are not alone, and that many people have gone through what you're experiencing and they found help. You can find help too. Talk to somebody you trust about how you feel. I'm going to say that right. Talk to somebody you trust about how you feel. And that's hard to say because we bottle it up because we feel if we talk to somebody, what we're talking about will get out, will leak out, will be on the pitch, and other people know. But I think it's important to talk to someone that you trust. Don't just go on the street and talk to somebody that you don't know or you don't trust. Talk to somebody who you trust. It's important. But the important thing is that you talk, and talk to a health worker, a nurse, a community nurse, or somebody like that, a counselor, a psychologist, or a doctor. Depression is a common mental disorder. It's important. And globally, you've heard me say how much it is. I've said women are more common than men. But I want to now talk about men. Even though women are more common than men, boy, we really have to look at the whole problem that's facing men. All right? And what are the symptoms of mental disorders in men? I want you to think about that for a second. And we're going to take a break. When we come back, I'm going to dive a little much further into it.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. What are the symptoms in men? Well, I'm going to talk in general, and I'm going to start to tell you a little bit of a difference between men and women. But in general, the symptoms you're going to find that indicate that there may be some sort of mental disorder, depression, is you're going to hear anger, irritability, and aggressiveness. Sounds strange. You're going to find noticeable changes in mood, energy level, and appetite. Difficulty sleeping, often sleeping too much. Difficulty concentrating, feeling restless, always on the edge. Increased worry about feeling stressed, and aggressive misuse of alcohol, drugs, or both. Male depression is a serious medical problem, but many men try to ignore it. They refuse to acknowledge it or even refuse treatment. If you are depressed out there, you have to learn the signs and symptoms and what you should do. Now, I'm going to ask you a question. Do you feel irritable, isolated, or withdrawn at times? Or do you feel irritable, isolated, or withdrawn for long periods of time? Do you find yourself working all the time? Working all the time is often a symptom of depression, believe it or not. I'm not trying to suggest work a holiday. There's no work today. You know, I'm not trying to say do a problem child on you. You know what I mean? Now, about drinking too much, drinking even during the day while at work, sneaking drinks. These may indicate some alcoholism, but rarely they often indicate depression. So these unhealthy ways of coping may be clues that you as a male may be depressed. Depression can affect men and women differently. When depression occurs in men, it is often, by and large, hidden by unhealthy coping behavior. Men are doing things to hide the fact that they may be depressed. For several reasons, male depression often is not diagnosed or treated and can lead to serious and sometimes tragic results. But when treated, male depression usually gets better. It gets better. That's why treatment is so important. And in terms of male depression symptoms, let's get it's important to know that with men and women, the brain chemistry, certain substances that are being released in the brain, serotonin. I don't want to get into the chemical names, but these are some of the names. The hormones and life experiences, these differences can stem from also the traditional role that men play in society. So in societies where men are supposed to be macho and strong, men would have a tendency of not coming forward to express that they're depressed or being diagnosed that they're depressed. And the expression of emotions is not the same. Women will express their emotion, men will not. And it's a big problem. Like women though, with depression, men and women feel sad, hopelessness, and empty. Both men and women have that. They feel very tired. Okay. They have a hard time sleeping or sleep too much. That's the thing with depression. You know, anxiety, you hardly sleep. Depression, you sleep too much. And then both men and women, they find they do not get pleasure from activities they enjoyed. We pointed out before. But certain behaviors in men are unique and could be symptoms of depression. Problems getting along with others. This is peculiar to that of men, especially getting along with your spouse or partner in a business or family members. And I want to say this word, escapist behavior. Escapist behavior. That is, such as spending a lot of time at work or on sports fields or so. They're escaping something. Might sound good. They're working hard or they're playing sports, but sometimes it can be a symptom of depression. Now, men also have physical symptoms such as headaches, digestive problems, the stomach upset, and pain in some unusual places, the back and so. And they definitely have a lot of problems with alcohol use and drug abuse. They can also have problems with controlling violent and abusive behavior. Men just get violent and abusive at times when they're depressed. And they can be irritable and anger at the slightest thing, like what I'm talking about there now. That irritability and anger. Well, I'm not depressed. You know what I mean? You know, and they start getting to risky behavior. They're depressed, but their risky behavior start to drive under the influence of alcohol. That's part of their depression, not necessarily to the alcohol. You know, the alcohol comes as part of the depression. These behaviors could be signs of and might overlap with other mental illness, no doubt. Or they may be related to a medical condition, like I mentioned before, diabetes, heart disease, and so. But in either case, professional help is needed. Either way, male depression can so often is not diagnosed. Men with depression often aren't diagnosed for several reasons, including, first of all, not recognizing the symptoms of depression. You know, the escapist approach to things, they caught their ears, they're just not going to bother, but they're depressed. You may find and you may think that feeling sad and emotion is always the main symptom of depression. But for many men, that isn't the main symptom, feeling sad and down. For example, as I said, headaches, digestive problems, tiredness, irritability, and kind of pain, long-term pain. I used to have some patients with pain. I didn't realize that they were really depressed. I couldn't treat the pain. The pain was just there coming back. I'm giving them some good medication, again, some stronger medication, but it wasn't so much pain. When we resorted to dealing with the depression, the pain went away. I could have been putting them on some strong stuff that they could get addicted to. And sadly, that happens a lot. So men can certainly feel isolated and seeking a lot of distraction so that you don't have to deal with the feelings of the symptoms themselves or the relationships. Another thing is, besides not recognizing depression, is downplaying symptoms. Just downplaying it. Or not wanting to get mental health treatment. I've said this a couple of times. Men hate doctors. Men fear doctors. And, you know, so the important thing is you have to get help when you need it. And asking for help can be very, very hard for men. But without treatment, depression isn't likely to go away. And it may get worse. Untreated depression can make you and the people close to you miserable. And if you can cause problems, you know, I mean, if that's the case, depression can really cause problems in all aspects of your life. Depression linked with other illnesses is going to affect your health, your career. How well you get along with others could even lead to breakup of relationships. Depression, even if it is severe, treatment can make this better. And that's one of the important things. Male depression and coping skills, something you'll learn. Know that your emotions and coping strategies to see how you can make your coping skills better is very important. Learn ways to manage stress. Some people use meditation, mindfulness, or develop some new skills of how they can solve problems. But you have to also learn to adjust your thinking and try new approaches to the situations. Decide on what is important in your life. Move forward with those values. Set realistic goals. Seek the emotional support that you need, usually through your spouse. So that's so great when that happens. If you don't have a spouse that's supportive, boy, that's a problem. Wait until you get better before you make important decisions, such as changing job or migrating also. Tackle depression first of all. Take part in activities you enjoy and stick with those activities. Stay on a regular schedule of all the health activities, whether exercise, seeing your physician. You got to do all these things. And certainly stay away from alcohol and drugs. Now, I've been trying to point out today that depression in women is far more common than that in men, but that it does occur in men. And what's unusual about men is that I think the depression is being under-recognized because men are trying to hide it. It's been swept under the carpet, but it's there and it's boiling over and it's affecting a lot of men's lives and they don't realize it. We know the causes. It could be a traumatic event, losses in life, all these other things, right? It could be something happened 3-4 years ago to you. And it's just really unfortunate. And it's important that men, even though we live in a machismo type society, it's important to seek treatment, critical to seek treatment.
But what would you say if I said to you that men who are depressed, the way they deal with their depression is so different that it's not even recognized as a state of depression?
That's the point. That's very true. That's number one. The depression and the state of depression is not being recognized. That's fundamental. It's not being recognized. And so they may think what they're doing is normal. They may think what they're doing is good. But what they're doing and the way they're actually behaving, the way they're feeling and so forth, can lead to prolongation of their depression. It could affect their family, could affect their job, could affect their life. They can start engaging in risky behavior. They can start drinking alcohol. They can start doing drugs. They can do all sorts of things because they did not recognize this early enough.
As being a state of depression.
And that with women, depression is often picked up relatively quickly and early, but with men, there's lots of ways in which, and depending on the type of society you're in, and the Vincentian society is one of those, where depression is going to be hidden, right? And treatment is not going to be sought. Not going to seek treatment.
Well, the thing is, men know how they feel, right? And it may not be, they know how they feel. It can be depression, but they know, as I said, they know how they feel. They may not call it depression. And then now let's say their wife, a man and a woman living together, but he's rather very violent, and the violence is because of his depression. But then it is not recognized as depression, but it's just recognized as he's just angry. He's just always angry. That's just how he is.
Yes, that's how it comes across. And that's where the depression gets chronic. And unfortunately, there are things that the man can do to help, and there are things that the family can do to help, but by and large, it's going to require some sort of professional help to really get the male to truly start to see what is wrong. You understand? And it is only then that he's going to say yes. And it will come out that 5 years ago, this took place, and they found that this is what's been happening. The link and the click and the connecting to the dots doesn't always take place. That stuff is buried, hidden, and they are unable to cope. And if they even have the nicest of spouses, the spouses, they're unable to speak. That's just how he is. He's like that. So therefore, I'm going to leave him. I'm going to go away, which compounds the depression, which compounds the problem, because it's being started to accept, well, that's the way how he is. That's me, how I am. But really and truly, he wasn't like that. He wasn't always like that. Very few persons who that is the way they were from a teacher, and somebody goes and marries them or people interact with them. There's definitely a change that takes place.
I mean, I think I might just be repeating some of the things that were said
Yes,
previously by
yes,
you.
yes.
But I think one of the challenges that we do not, it's very difficult to recognize depression because it comes in so many different, at least the symptoms, the signs comes in so many different ways and so many different forms, that it's so difficult to recognize, and it's being passed off as something else.
Well, it could also be something else in addition
to the depression.
There could also be the onset of diabetes. There could be heart disease. There could be illness. And that's why men often tend to experience, as I said, headaches, digestive problems. But they won't necessarily go and seek treatment for it, or they won't tell nobody. They got a headache, or they got upset stomach, I ate the food, they're bloated, they're belching, they're farting, they're doing all sorts of things, like I say already. There's pain in their stomach, pain here, pain there, but they ain't complaining that, oh, I've got pain, oh, I've got pain, I've got pain. They ain't doing that. They're sucking it up. They're biting their lip and they're bearing it. And these could be coming from the depression, or the depression on top of an underlying illness, compounding the whole situation. And yes, it's good to be able to separate out the diseases, put this disease over there, put that disease over there, and put the other one over there. And let's treat it. But they're all interacting with each other and compounding each other, making one big soup. It's hard to pull the vegetables and the spices and everything out of the soup. You understand? With that was put inside there. And similarly with the illness, the way the person's feeling. The depression can be a very strong component that causes it or comes as a secondary effect of it. You know?
Well, I think that they just need to be a lot. People need to be sensitized. And I'm not sure if we have or even have enough programs, a facility. I mean, is there a facility in St. Vincent where somebody who can go that is depressed?
And you are?
A facility.
Well, yes, there are doctors and there are psychologists that you can go to. on a private basis to really get the sort of counseling you need. There are a number of persons. Are there a lot of places for the general public to go as if like you go into a clinic and so? There isn't a lot. Do we have an Alcoholic Anonymous here in St. Vincent? That's very successful and so around in other parts of the world. We don't tend to have a lot of that, you know? And so, yes, we do have the professionals who could treat you, and sadly, if you may have to bring the money and so forth to seek those kind of treatments. You see it in the United States, people go in and they're sitting down with their psychologists, movie stars,
movies and
musicians, and so on. You know, they go every week and they talk about all the things. But I could imagine musicians, you've worked hard on an album and then it crashes, it doesn't sell. You know, you sell 10 copies. What, you know,
you get stressed and depressed.
That's depression, especially if you pump a lot of your own money inside there, or your publicist tell you you're now broke, you know, you got no money. I think what I've been trying to emphasize is that a part of this is that we've been culturalized in St. Vincent and in many parts of the world, that going to the doctor is for odd things and is a bit like being female, you know? And so we don't go. We suck it up and we deal. But bad things happen to men too. Men have a close relationship with their mothers, so the loss of a mother can be damaging to certain men. The loss of a close friend, a spouse, and so these things could be the loss of a limb, having a leg cut off. The impact of that is having a great job and losing it. I mean, there's some good reasons why people should be depressed. If you have a great job and you lose it, and you can't get back another job, that's enough to be depressed about. But it's how do you cope with it?
Yes. I don't think I can ever think, or I don't believe, I don't know if somebody could tell me of a man who has ever gone to the doctor because he was depressed.
A lot of men go to the doctor because they're depressed, but then the doctors may also make the diagnosis. So they may go to the doctor and say, they go to the doctor, I'm having a headache, I'm having digestive problems, I am having problems with pain. And the doctor will come up, yes, we've gone through the test, but I think that
you are depressed.
Because the doctor also run a social history. You know, what do you do? What's your eating habits? How often do you do this? How do you do this? And we could come up with certain things and a profile saying that you are a high-risk person for depression.
Okay.
You know? So, but you asked a very important question. But you know the question you're asking? You're suggesting, and I got to say, if you're a real man, you ain't going to no doctor for depression. You know what I mean?
I didn't even think of a real man.
You did not say that. You did not say that. But I'm reshaping your question for a number of other listeners. You are in effect saying, never heard of a man going to the doctor say I'm depressed. You know what I mean? No, man. What's wrong with him? You know, what's wrong with him for going to the doctor for that diagnosis? Go to the doctor to say you have pain in your back or you have a headache. Yeah. But you got to suck it up. But it may also be that you're relatively young and you haven't had much of these things. Mm-hmm. And so therefore you can't see. As people get older, as they start to lose a lot of their friends in their lives, who they once moved with, hung out with, or they had, it can be very scary for some people. There can be depression, you know, and certainly losing important parts, losing a limb. For women, you have a breast cut off, that could be very depressive. You know, diabetic, you've lost 3 toes. You go back in the hospital, they want to take off your heel. That's why they want to take off the bottom of your foot. That stuff is really depressing. And even though it happens, it's okay that depression can be treated and you could feel better as a result. Even though you're supposed to be depressed as a result of those things, that depression can be treated. And that's the point I'm trying to make.
But
You know?
I think, and you did mention it, right? It's one of the ways. The effects of what is happening is because of the way that we're cultured, right? And it's unfortunate, but the family system, I believe, right, should actually be the first support system, right, where somebody who feels depressed feels differently could turn to somebody in the family and say, because I could turn to my brother and we could talk just about almost anything. But I think in a lot of family we don't have that structure. And also I think you mentioned it as well, the trust issue.
The trust issue.
Places
who do you talk to? Who do you talk to? But let me come in here and say, society has been changing. When we were young, we might have been taught to suck up, and you get chopped, you stump your toe, and you have a fight in the playground, and somebody chop you, and you throw a stone at you, all that kind of thing, and you got to suck it up. Today, our sons and our daughters are growing up not necessarily a more sheltered life, but they are growing up with the risk of these same symptoms, but they haven't had the experience of having to suck it up or the machismo thing that men do. So the young male is probably going to seek medical treatment earlier than a male of 30, 40 years ago because of the new culturalization in terms of how we baby our kids and we provide them a lot more things and so on. They cry, we hug them and all that kind of thing. Long ago, a lot of people never used to get hugged when they cry and so forth. You know what I mean? So that wasn't reinforced.
Wait, you just you just draw my memory to something, right? I experienced. It's an experience I'm gonna share here with you, and it's very interesting. I met someone, a friend of mine, and that person said to me, that they post on Facebook, because they feel depressed, and it's more personal, right? But it was one of the way of dealing with a state of depression, posting to Facebook.
And Facebook is how old? 10, 12, 15 years? If that much, a person probably been on Facebook for the last 7, 8 years. WhatsApp, Instagram, all this kind of stuff. I'm saying to you, these are the new culturalization, and our kids all have cell phones and so forth. So that with the new culturalization, I think the young kids are probably going to be seeking out treatment for therapy for somebody attacking them on Facebook. Yes. Ladies and gentlemen, I think we've gone past that time.
Yeah, we're at the top of the hour.
And it was wonderful speaking to you this evening. Please, our men out there in particular, do be very careful and do look at the symptoms of depression. I'm sure you don't have any, but if you do, seek treatment. This is Dr. Gerald Thompson. Always, your health matters. Good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open